We don't have the Jeopardy clock right now. Oh, Miss Tongs. Yay. My friend's on.
Bobby? Oh, you're muted, Bobby.
Yes, ma'am.
As we get started, and you do the welcome, would you invite everybody, if they haven't already, to put their last name into their name so that I can take attendance?
Their last name into their name. Okay.
Yeah, so they would just click the dots beside themselves and change their name, rename themselves, including their last name. That would be great. Thank you, thank you. Betsy raised her hand. Let's see. Betsy, I'm going to get to you and see if I can allow you to talk. Go ahead, Betsy. I think if you unmute yourself, you should be allowed to talk. Betsy, are you able to talk? Betsy, if you aren't able to unmute yourself or aren't, I've given you permission to talk. And so you should be able to speak. And if you aren't able to, do you just want to put that in the chat? Your question, that would be great.
Bonnie,
Yes, sir.
where is that located again? You said the little three dots to find that menu?
So when they click on their name, they should be able to change their name.
Okay.
So I click on participants and then I see my name, and then beside that there's
Oh, it's actually in
mute
your
or
own
the
window.
three
Gotcha.
dots.
Gotcha. Okay. Just wanted to make sure I'm telling people to go to the right spot.
It's 1:04. Are we gonna move on, get started? We have 25 people in right now.
I say so. Yes.
I-
My time.
Ready?
Go for it.
Well, hello and welcome to the 23rd Annual Striking a Balance Caregiver Conference. I'm Bobby Meehan with Age of Central Texas. We are a regional nonprofit organization that serves older adults and family caregivers. Age of Central Texas, along with our partner, the Area Agency on Aging of the Capital Area, hosts this annual event. It's the largest, longest running free caregiver conference in Central Texas. So all this week, we're going to bring to you experts and resources to help guide you and empower you throughout your caregiving journey. Now, before we start today's presentation, I'd like to take care of a few housekeeping items. First, please include your last name in your Zoom appearance window. So just click the little three dots next to your name to open the settings window, and then click on rename and then add your last name to that. Next, we are recording all of these sessions and posting them to the Age of Central Texas YouTube channel. So if you miss one or would like to watch it again or even share these resources with others, go to the Age of Central Texas YouTube channel to find those. We will send those links to you at the end of the week, along with the resources learned, including the PowerPoint slides from each presentation. And we'll also send you a digital copy of the program for this year's conference. Finally, this program is for you. We want you to feel comfortable and to ask questions during this session. Just to look down at the bottom of your screen and you'll see the little chat feature. It looks like a little dialogue bubble that you see from the comic strips. So click on that and the chat will pop up on the side of your screen, and type in your questions. And when the presentation ends, we'll go through your questions and allow our guests to answer each one.
Bobby,
So
I'm going to interrupt and say it's in the
Yeah.
Q&A that people need to type into their questions is in the Q&A.
Exactly. So at this time, I'd like to introduce you to Emily Rollins, who's the owner of Town Square in the Northwest Austin. So she is our sponsor for today's session. So Emily, thanks for joining us.
Thanks for having me, Bobby. I'm really excited for us to be able to support all of the mission that Age of Central Texas has, including the Striking a Balance Conference. As Bobby mentioned, my name is Emily Rollins. I'm the owner of Town Square Northwest Austin. We're a senior day center located between Research Boulevard and Anderson Mill. And our mission is to make every day that our members attend our center to be the most joyous day that they can have. We have programmed activities from 9 a.m. to 5 p.m. Monday through Friday. And our activities center around productive activities, leisure, self-care, and wellness, as well as restorative activities. We believe that the benefits of being able to be in a social environment and being welcomed and feel comfortable with the people around them is really important to our seniors as they age. And we provide a network of support around caregivers who may feel overwhelmed in regards to their daily responsibilities, and try to help bridge the gap between being at home as well as if it's ever necessary to move into assisted living or memory care. So again, we're really happy to be able to sponsor today's message, and we look forward to the rest of the conference this week and the in-person meeting on Saturday.
Emily, thanks so much. And thank you again for Town Square sponsorship of today's show. So now it's my pleasure to introduce to you Shirley Trapani from the Area Agency on Aging. And she's going to tell you a little bit about AAA and also introduce our speaker. Shirley?
Thank you, Bob. Thank you, Bobby, and thank you all for being here today. As Bobby indicated, my name is Shirley Trapani, and I am the Assistant Director at the Area Agency on Aging, one of the assistant directors here. And it gives me great pleasure to be a part of this conference overall, and a lot of pleasure in inviting Ginny to participate in our webinar today. The Area Agency on Aging offers support, health, and the health and safety and well-being of adults age 60 and older. And we also offer support for persons of any age that have a disability. We have a variety of programs that we offer through the Area Agency on Aging and the Aging and Disability Resource Center. And those include, to name a few, we have information referral assistance where people can call in and we can offer a variety of resources to provide to them on whatever their needs may be. We also have benefits counselors that counsel people on Medicare benefits. We have an ombudsman program that works with the assisted living centers and facilities and nursing facilities in regards to people's concerns or questions about where they are or anything that's concerning them or their family member. We also offer health and wellness programs and care coordination, caregiver support services, nutrition services and programs, medication screening, and as I indicated, we have the Aging and Disability Resource Center, for which we have a program called Lifespan Respite, which can be offered through the ADRC. And again, if you have any questions, feel free to place those into the Q&A. And I would like to introduce Miss Ginny Erboe. And the next slide, please. The introductory slide. Thank you. So today we have Miss Ginny Erboe, who is a registered nurse from Hospice Austin. And I've known Ginny for a number of years, and great pleasure to have her on board today to present all this wonderful information on advanced care planning. And Ginny has been a nurse for over 30 years, and she has a master's in nursing from the University of Texas. And 23 of those years she's worked in hospice care, probably a little longer, I think at probably like 24, I think at this time. She also has experience working in cardiac care and the electrophysiology lab. And she's been a very big part of the GIFT project with Hospice Austin, which she'll be talking a little bit more about into the conversation. Then we have Reverend Beryl Kenney, who's also of Hospice Austin. She has decades of experience as an educator, holds a bachelor's degree in political science and a Master of Divinity with a focus on Hispanic studies from the Seminary of the Southwest. Since 2011, Beryl has served as a chaplain in Washington, Alaska, and Austin, working with various hospitals and hospice. She has training in conflict resolution, advanced directives, end of life, and spiritual care and funeral planning. And she's passionate about helping others with these challenges throughout their life and end of life. And it gives me great pleasure to introduce both of these ladies today. And take it away. Thank you.
Well, thank you, Shirley and Bobby. We are super excited to be here today. It will be a sort of quick, more sort of providing information to you guys. I did add my address, my email address, and my contact number in the chat box. If you want written materials, sometimes that's just a little bit easier. You can either email me directly, or you can add your address in the chat box, and Beryl will write that down and we'll send a packet of information to you guys. We also will be sending out a zip drive that has all the resources in it, except for the Hard Choices book. But you can look at those. It's a little hard to print out, so we do like to send them to you if possible. Let me share my screen. Let's see. Oops. And so the project today is called GIFT, Giving Instructions for Tomorrow. St. David's Foundation provided Hospice Austin with a grant to go out into the community and provide this free education on advanced care planning and helping people complete their Texas advanced directives, as well as kind of giving some information about hospice and palliative care in a very broad sense.
Ginny?
Yes.
I'm just going to interrupt you and let you know that you've shared it so we can see your slides, like your note slides as well.
How do I change that then? Let's see. Stop share.
I think you go through presenter mode.
Presenter mode.
And then.
Okay. Let me see. Hold on. Let me close that. Okay, so here is my share screen. Thanks, Bonnie. Okay, there's that. Start from beginning.
Yep.
Let's see.
Then go over to slideshow.
Oh, there it is. Okay.
Yep, there you have it.
Move y'all out of the way. And then go to.
You're sharing right now.
Okay. Can you see just the slides now?
We sure can.
Okay, thanks. So St. David's provided, this is our 8th year in the grant. We've done this talk for probably close to 10,000 people in the community, and we're certainly excited to add you guys today. So there's some little fish in the fish tank saying, I've already made arrangements to be flushed down the toilet. So if the fish can do it, I definitely think that we can do it too. So today's learning objectives are going to be talking about the importance of advanced care planning, starting the conversation with our loved ones and our healthcare providers, as well as resources available to start to have these conversations and some resources to wrap your mind around this topic. We'll briefly review basic medical interventions, discuss palliative and hospice care. I'll mention a go bag for the hospital and an ID bracelet just as resources, and then review the advanced directives and what they are and how to complete them, especially for the state of Texas.
We have a hand raised from Lawrence. Lawrence, will you put your question in the chat in the Q&A? Or would you like to go ahead and speak right now? why don't you put it in the Q&A, Lawrence, and we'll answer you there.
Okay, and if not, then just let me know. We're glad
I
to
will
take
do that.
questions, and I wish I could see you guys a little bit more and get to know you guys a little bit more intensely, but due to the webinar, it's not as easy to do that. So I did add my email my email address and my contact number, or you can email Shirley Price also for those resources. So how many people like pizza? If you can find your little icons and put your hand up. Well, and sometimes we find pizza often softens the blow of bad news. So, you know, I don't think that today's topic is really bad news. It's just talking about getting prepared for our future and the care that we might want at the end of life, or if we were faced with an emergency. So any of those things could occur for any of us. And there's 100% guarantee that we are going to face death at some point in time in our life. I'm sorry, that may be bad news to you. But what is advanced care planning? So advanced care planning is really just that conversation between ourselves and our loved ones with our healthcare providers, talking about what's important to us. What are our values and preferences that may help guide our medical care if we're not able to speak for ourselves? So the most important piece, if you want to take away from this talk today, is actually starting that conversation with your loved ones, with your friends, your family, your healthcare providers, about what's important to you if you could not speak for yourself to make medical choices. So I want to show you some websites that are some great resources. One of them is the conversationproject.org. Let's see, there it is. In the packet of information, we do have a booklet that has all of this in a written form. So if you're more like me, I like paper pen and can actually just write stuff down and get my hands, you know, available with the information versus just online. But the conversationproject.org has a wonderful website. They actually have 19 different languages. So if German or Spanish or Hindi is your primary language, you can actually dive into the materials in your primary language. So through the website, they kind of just go over the conversation starter guide, the importance of thinking about when you choose somebody to make medical choices for yourself. We'll go over a few of those things. And the website is a great place to just walk through some of these things and some things to think about as we start to grow and expand. The other website that I really love that ties everything together, especially if you want to look into this information a little more closely, is the stanford.edu website. And so it's actually for Parkinson's, but they have all this information on their website that really ties everything together. So they have the National Institute on Aging, getting your affairs in order, the 5 wishes, which is a wonderful packet of information. There's AARP, and the list goes on and on. I think Conversation Project is also in here. So this is an extensive resource page that's very helpful, especially if you want to look into answering some more questions and getting into this materials a little bit more closely. So medical interventions that I want to just briefly talk about as we go through this. So a couple things as we start to think about this. So if you are healthy, really this is just basic insurance in case if we have an emergency or an accident where we can't speak for ourselves. If we have a chronic illness, it's really providing information about that illness and what challenges you may face in the future, and sort of looking at those things with your healthcare provider team and thinking about what's important to you in regards to goals of care, as well as your values and preferences. And then if you do have advanced disease or a terminal illness, it's really hoping for the best and just getting prepared for what we might expect as our disease worsens. So we do have a booklet called Hard Choices for Loving People. It's written by a chaplain named Hank Dunn. It's a wonderful resource. We did shorten some of that information into the workbook that they will be emailing out in that zip file at the end of our talk. So there is a shortened version, but if you would like the actual hard copy, once again, just email me or put your address in the chat box and Beryl will write down your address. We'll mail you all these resources. So for medical interventions in a very broad sense, when we're actually laying in the hospital bed or our loved one is laying in the hospital bed, that's not the time to be sort of figuring out the foundation work of what these interventions are. And I know that the doctors just come into the hospital room and start, saying all this information in a quick 5 minutes and asking about whether or not those are interventions that you would want for yourself or your loved ones. And you might not really know what those interventions are. So wrapping your mind around these things when we are not in an emergency or crises is kind of a great idea. And so we're just going to go through a few of them just to start to think about some of these things. In regards to intervention, you can always opt to do a time trial. So at the hospital, that's kind of what we're doing too. We may opt to do a time trial of IV hydration or tube feedings or medications. And so just know that that's something that you may want to write into your directives or talk with your family about. I'm my medical power of attorney for my mom, and she said, like, if she got an infection or a pneumonia, that she would be willing to try interventions for about a week. But if she was not going to recover or be able to be independent on her own, that she just really said to let her go and to focus on comfort care. So that's probably not what I would have done for her, but I'm glad that she expressed that to me so I can follow her wishes. So one important thing to think about is cardiopulmonary resuscitation, or CPR. So it was really designed in the 60s for a sudden death like a heart attack, a drowning, or electrocution. And it is a process where we, if somebody stops breathing or their heart stops, we initiate a series of interventions to hopefully regain their circulation and regain their breathing capacity until emergency personnel can get available on scene. So it hopefully brings a person back to their current health. So it's a hard question because when we ask our loved one, well, do you want CPR or do you want to die? I mean, well, most people would say, well, I don't want to die, so therefore it must be, the first answer, which would be, yes, I want CPR. Well, that's not a great way to phrase things, right? We have to think about where we are in life, where our current health situation is, and isn't an appropriate measure to have CPR at that time in our life, right? So there are severe side effects such as punctured organs, broken bones, especially if CPR is done appropriately, and then the possibility of being on life support machines or decreased mental capacity with a decreased ability to ever regain independence back to where they were. So there is an appropriate time for CPR, and there's also a time when allowing natural death may be appropriate. Artificial nutrition and hydration can be done in several ways. One way is through an NG tube or a nasogastrial tube. That's a nose down to the stomach tube. That's usually a very temporary intervention that they do at the hospital. Usually about a week or two is as long as they like to leave that tube in. It can provide feeding, hydration, medications, and can also be used to decompress the stomach in case if somebody's really nauseated a lot. The more permanent type of situation would be called a gastrostomy tube. That's a little tube that's placed usually between the wall, the outside wall into your abdominal stomach. It's usually done as a surgical procedure, and that's a little valve that can allow for hydration, nutrition, medications, and then also decompression. One important thing to realize is that any contents in our stomach can be coughed up into the lung space, and that's what we call an aspiration pneumonia. So I didn't realize that any even artificial means of putting contents into our stomach, you can still have an aspiration pneumonia occur. So that's something to keep in mind. The other ways that artificial nutrition and hydration can occur is through an IV. And so IV is intravenous. And I think most people are familiar with that. That's where they place a little catheter into our veins and they can do hydration, nutrition, medications through that IV site. One thing to note that a lot of times as our family and friends and as we approach the end of life, we always think, oh, if we don't provide nutrition or hydration at the end of life, then we're either starving or causing dehydration for that loved one. Well, they did an interesting research study where they took blood work from patients that were dying who did not receive IV hydration and drew labs on patients who did have IV hydration at the end of life. And they found that those that did not have IV hydration had natural endorphins running through their body that allowed them to feel a more euphoric or happiness state as they were dying or leaving this world. So that's one thing to sort of start to keep in mind. And all of that information is also provided in that hard choices for loving people booklet that I was mentioning that we can mail to you. There are some life support machines just to kind of start to think about. Ventilators are when our lungs either start to fail or need a chance to recover. We may be placed on a ventilator, which is a machine that is where have a tube placed down our throat, connected to a machine that will breathe for us. A lot of times that's utilized during surgery, or we started to experience that more during COVID. And so we did see a ventilator use increase during that time. There is a time and space, once again, for ventilators. A definite time and space not to be attached to a ventilator would be if your lungs are already disease ridden, or there's no chance of improvement for your lungs. If you're placed on a ventilator, there's not a chance for them to come off of the ventilator. And so most likely families would have to decide at some point in time to turn the machine off, and that most likely that would lead to their death or demise. There are other interventions such as medications that can help a person breathe easier, and that is definitely what we use when a person is on palliative or hospice care versus being placed on machines. Dialysis is a machine that is utilized when our kidneys stop functioning or start to fail. Dialysis is where we're connected to a machine and it filters our blood, or the peritoneal dialysis. So hemodialysis is where you're connected to a machine and it filters your blood. Peritoneal dialysis is a process that actually flushes fluid through your abdominal space and removes toxins that way. Peritoneal dialysis is usually done at home 6 days a week. Hemodialysis can actually be done at home now also, but most of the time people go to a clinic 3 days a week, usually for 4 to 6 hours at a time to have hemodialysis done. It can be a temporary or a lifelong process. And some interesting statistics about dialysis is that elderly patients placed on dialysis, usually 76% are hospitalized in the last year of their life, most requiring some sort of intensive care stay. And they also did a study that surveyed elderly patients, and they came out with saying that nobody that were in the advanced age of their life had an improved physical health after a year of dialysis. Antibiotics are something to actually wrap your mind around thinking about. So antibiotics treat an infection. They can be done orally or IV. They can, and also injected as a muscular shot. And before the 50s, most deaths were caused due to an infection. And, back then, pneumonia was actually called the old man's friend. So dying from an infection can be a very peaceful and sort of quick way to die versus living with like an Alzheimer's dementia that may take years to actually decline and pass versus where they may not know what's going on, they might not have a good quality of life, and they may require care for all of their activities of daily living. So it is important to talk with your healthcare providers about the pros and cons. So an example would be like, say, for instance, somebody with an Alzheimer's dementia starts to get either a frequent pneumonia or a urinary tract infection where they're required hospitalizations. Maybe, it was once a year, then twice a year, then quarterly, then almost every other month, and then maybe even monthly. And so at some point in time, a family may just decide to withhold antibiotics and allow their loved one to pass. And that is not a cruel or inhumane thing to do. So really focusing on goals of care and quality of life for any intervention is a good way to think about, are those interventions supporting my goals of care and the quality of life that I would like?
Ginny, we have a question that I think we should answer at this moment.
Okay.
Rebecca asks, does a do not intubate request cover both nasogastric and gastronomy interventions?
So repeat, maybe I can see it. Repeat that again.
She wrote, does a do not intubate request cover both nasogastric and gastronomy interventions?
No. So at the hospital, very specific things can be written out or allowed or not allowed. So I will go over out in the community. Do not resuscitate. It's called an out of hospital do not resuscitate order out in the community. And that only covers 4 interventions of chest compressions, which is like pressing down on your breastbone to beat the heart underneath, some sort of rescue breathing, shocking with paddles or a defibrillator, or pacing with those paddles. So in the hospital, you can specifically say, whether or not you would want the feeding tubes or those interventions. And you can also indicate those on your directives if that's something you do or do not want. And we'll dive into that a little bit more as we talk about the directives, and I'll let you guys know where to include those interventions if you do or do not want those things. So diving quickly into hospice versus palliative care. So if you do have more questions about hospice or palliative care, be sure to add those in the chat box, or we can also meet with you guys a little more intimately if you have more questions. But hospice and palliative care, there's lots of questions about what they are and what the differences are. So both are specialties that focus on quality of life. They both focus on looking at a person as a whole being. So that includes emotional, spiritual, physical, and mental aspects of their life. Both have an integrated team approach that support a person. Both are paid for by Medicare, Medicaid, most private insurance companies, self-pay, or charity programs. So Hospice Austin and Austin Palliative Care both have charity programs in their programs. Access services can be done by self-referral, doctor referral, family or friends reaching out to either organization to start the process, or a hospital can reach out to any of those organizations. Let's see what happened. So palliative care is a specialized care or a consult service for those with a serious or chronic illness. So just like you may have a cardiologist or a primary care or a kidney doctor, lung doctor, cancer doctor, palliative care is actually one of those specialty consultation services. They do allow to continue treatments and aggressive care. Their focus is on pain and symptom control, communication and coordination of care. Oops, I'm sorry, I put acres in there. Emotional and spiritual support, as well as support for family and the caregivers. It can be a home or office-based specialty, and there is a team approach. So there's usually a doctor, nurse practitioner, registered nurse, social worker, and chaplain. And then there is also a physician available 24 hours a day to answer phone calls. So that is a nice part about the service, especially if in the middle of the night somebody's having issues and they don't necessarily want to go to the hospital or need to go, but they can actually reach out to a physician that will call them back and answer questions and be available. We are affiliated with a group called Austin Palliative Care. You can go to their website to see how to access resources. They are a St. David's Foundation recipient, so they do have services for even those that don't have insurance or any sort of funding. And in regards to hospice care, there's usually a terminal diagnosis, and the focus is on comfort versus more curative or aggressive symptoms. So if you think that it wouldn't be surprising if Uncle George wasn't with us in 6 months, if you think, wow, my loved one's been in and out of the hospital so much, has lost weight, has these things going on disease-wise, and I wouldn't be surprised if they weren't with us in 6 months. Your loved one or friend or family may qualify for hospice services, and you could reach out to an agency. You could simply call even our agency, Hospice Austin, and just let them know what's going on. We're glad to send somebody out and do some behind the scenes work that we may need to do and evaluate somebody for hospice services. You can have hospice services to support a loved one just to help them feel better. And if they got better in a couple months, then they may graduate from hospice services. And then you can just call us back at another point in time if there's a decline. Sometimes with hospice services, people do tend to get better, right? They have the support and the love coming to them, somebody to help navigate medications and services so that they can start to improve care. Hospice does focus on symptom management and quality of life. There is a team approach that is a little more inclusive versus palliative care. There's a doctor, nurse practitioner, nurses, social worker, chaplain, an aide, homemaker, volunteers. We can also access physical therapy, occupational therapy, and speech therapy for limited amounts of visits versus more sort of skilled rehab care that you may see a physical therapist or one of the therapists more intensely. We have nutritionists and wound care available. Durable medical equipment can be delivered within 24 hours. Medical supplies are included. Medications are also included. There's an on-call nurse, chaplain, and social worker available 24 hours a day. If somebody needs a visit, they can actually go out and make a home visit anytime. And then different levels of care that are included would be routine care. General inpatient care is at a hospital or an acute care facility. Hospice Austin actually has a facility, inpatient facility called Christopher House. And so a person could utilize that facility for symptom management or very end of life care. We also have respite and crisis care available. And so respite care is if the caregiver needs a break or if they fall ill, a person could go get respite care at a facility. And then crisis care is actually staff that could stay with somebody in a home setting, hours up to days through a situation if they did not want to return to an acute care facility. You can,
Ginny,
yes.
are the criteria for hospice services different for dementia-related disease such as Alzheimer's?
So yes, there are very specific criteria for each disease process, but the biggest ones, well, one, you can always ask a hospice team to come out and evaluate a loved one. Now, for something like Alzheimer's or maybe COPD or heart disease that people could last a very long time with that disease prognosis, things like a decline in physical or cognition, rapid weight loss, an increased need in caregiving help, all hospitalizations, all of those things add up to create a picture where we present that information to a physician who would need to agree, yes, to their best knowledge, it wouldn't be surprised if their loved one passed within 6 months.
Thank you.
Absolutely. So a couple little tidbits, as a caregiver or for ourselves, having a to-go sort of medical file available is really helpful so that you can get the most efficient and fast care, especially at the hospital. So in that little file or the paperwork that you may have available is identifying who you would want to make medical decisions for you and their contact information, a copy of your directives, including that medical power of attorney that assigns that person legally to make medical choices for you. We'll go over that. A list of medications, including the dosage and the frequency, and maybe even what they're for, if you know. A list of a medical history for that person, a list of their physicians and specialists, list of family and friends contact information, and a copy of their identification card, their insurance cards, their social security number, their Medicare number, all of that kind of in a little packet of information that you can present to the ER is super helpful so that they can get the most efficient care possible. One other thing to think about is if you have somebody's with an Alzheimer's, dementia, or possibly chronic illnesses that they may faint or pass out, just getting a medical ID bracelet. You can purchase one on Amazon, or you can even just Google ID bracelet and purchase one for anywhere from $15 to $50, depending how fancy you want it. Actually, my husband, he was an avid runner, and he actually had one because when he was out running, he didn't have any medical or any identification on him necessarily when he was out on his long runs. So just having this available for our loved ones as we're out in the community may help once again address any immediate needs like a low blood sugar, or seizure disorder. And it's super easy just to have available so that we can get the most efficient care. So how many of you guys have your medical power of attorney completed? If you can just put your hand up or a thumbs up, we can kind of see. Oh, that's awesome. I see the numbers going up. I saw the number go up and down. Well, don't feel bad if you don't have yours done. We did a survey at Hospice Austin, and we deal with this information all the time. And less than half of our staff actually have theirs completed. Myself and my team, especially my director, her name's Shirley Price, we didn't have ours done until we had done this talk for probably about 2 years and then realized that, it's important for everybody to have, including us. So anybody over the age of 18 should at least have a medical power of attorney. So any of the caregivers, you can give this information to your family, grandchildren, any of your children. Your parents should have theirs, as well as yourselves should have yours. And they're really super easy to complete once you kind of wrap your mind around what the form is asking for. So we're going to dive into that a little bit more now. Let me see what time it is. Okay. So what are advance directives? Advance directives are basically legal documents that document what your values and preferences are in case if you cannot speak for yourself. So that's all advance directives are. And every state looks at their directives a little differently. So it's important to know that every state has different directives. Texas is unique, of course, because all of our directives are separate forms. There are 44 states that actually honor a packet of information, and it's on that stanford.edu packet called the 5 Wishes. The 5 Wishes can actually help support and honor your documents, but you do need to do the Texas directives in the state of Texas instead of those 5 Wishes packet. Most states will honor other forms from another state. It's important to know what your state sort of laws are. I will say most honor other states' directives. But if you do spend half time maybe in Colorado or half time in California or someplace where the weather is beautiful compared to Texas, you may opt to go ahead and complete those directives in that state. Be sure to review your directives from time to time because our answers or forms may change as we age. And so a lot of times we did these forms with our attorneys. Just know that you can do these medical forms on your own for free. Most attorneys charge anywhere from $350 to $1,000 to do your medical forms, but you can update them yourselves for free and keep those current. If you've done maybe your estate plan 20 years ago and you need to update some of the information. One important piece to know is that they do not want any crossouts or errors or things corrected on them. There's actually a clause in a statement that says it makes that form null and void. So if you do need to update somebody's contact information or their name or address or something like that, I'll show you how just to redo those forms. Or if the name is correct, just leave it. And those forms are valid, but you just want to make sure that the healthcare providers can reach those people in a timely manner. So the 3 forms that I'm going to go over really quickly are the medical power of attorney, the directive to physicians, and the out of hospital do not resuscitate order for adults in the state of Texas. So the medical power of attorney, or in some other states is also known as the healthcare proxy, is assigning somebody to make medical choices for you if you could not speak for yourself. The medical power of attorney only goes into effect when you cannot speak for yourself. So just know that your medical power of attorney can't override any choices that you make as long as you cognitively are able to make those choices. So some important things to consider when assigning a medical power of attorney is, can that person speak up for me? Can they ask good questions to doctors? You don't want to pick a child, or if your spouse is too tender-hearted or can't ask questions like to a professor or to the doctors, that might not be the best person to represent you. You might opt to pick a neighbor or somebody a little further removed emotionally from your care. But just let your family and friends know why you're asking somebody else to represent you. So that way there's no surprises. I have been at a hospital where a neighbor was assigned and the family didn't know, and they were kind of surprised and didn't understand. So just definitely let your family and friends know if you want to save them from the burden from making those hard choices. That's okay. In the state of Texas, if you do not have a medical power of attorney in place, it is automatically assigned and they start to look for these people at the hospital. First, a spouse, then grown children, then parents, siblings, nearest relative. So they'll look for those people to make medical choices for you. If you don't have any of those people, then eventually an ethics team usually gets together, and two physicians usually will get together and make decisions for that person if there's nobody else to represent them. So this little form that I added here is the Texas Medical Power of Attorney. You can access these forms on the hospiceaustin.org website, just under Advanced Care Planning. They're listed there. Also on the Texas Department of Health website, you can find these forms and download them and print them out. We'll also send them in that zip file. So on this form, you would simply add your name, your legal name across the top in this space. You would indicate below your name who you want as your primary person to speak for you with their address and phone number. Below that, you could list any limitations or specific instructions. Most of the time that is left blank so that your medical power of attorney and your healthcare providers can talk about the situation and make decisions for you. But if there is a hard truth that you know that you do or do not want, you can indicate that there. Below that, there is a space for your first alternate agent and your second alternate agent. A common question we get is, can you have more than one primary person? You can, but it is the easiest and best if you have one person assigned. That one person can talk with the other alternate agents, but that is your primary spokesperson for the healthcare team to recognize as who is making your decisions as your primary agent. At the bottom of this form, it's not as important, but it's saying that the original is kept at and these following people have copies. You can fill that out. What is important to know is after you fill out your directives, please make copies for your healthcare providers and all the people on the directive, as well as your family and friends, so that if you end up at the hospital, people can show up with these directives and allow the healthcare team there to know what your wishes are. On page 2 of this form, you can have a notary witness your signature, or on the back, there is this keyword "or." You can sign it in the presence of 2 witnesses. They ask that this first witness, this statement here is saying that this first person is not related by blood or marriage to you, not going to gain anything from your estate, and not in direct care of you at the time of the signature is occurring, that is not in direct care of you. Witness 2 can be anybody or any of those people that are requested that the first witness not be. And then your medical power of attorney is completed. So once again, up at the top of this, at this top of this page, it says this document may not be changed or modified. So please just redo a medical power of attorney if you need to, if any of the information is incorrect. I am not looking at the questions at the minute, but Bonnie, we can address any of those here during Q&A if needed. The directive to physicians is also known as the living will. And so this form allows you to direct your healthcare team and your loved ones or your family and friends in regards to what kind of care you would want if you could not speak for yourself. And there's 2 different situations that arise. One is a terminal condition or an irreversible condition. And so once again, this form only goes into effect if you cannot speak for yourself and these 2 conditions come up. So on the directive, you would simply put your name across this little box here. And in this first statement, it says, if my physician says I have a terminal condition and I'm expected to pass within 6 months, I would like to have comfort care and allow to die as gently as possible, you would initiate this top box. Or you would like to be kept alive in this terminal condition using all available life-sustaining treatment. So you would just initial those boxes given a terminal condition. The bottom box says you have an irreversible condition and you cannot care for yourself or make medical choices or make any decisions for yourself. Would you like to be kept comfortable and allowed to die as gently as possible? Or would you like all available life-sustaining treatment? And you would just initial which box you prefer. On the back side, there is a chance to indicate once again at the top anything specific that you do or do not want. In the middle section here, it says, if you don't have a medical power of attorney, you would like to assign these two people to make choices, but in bold, it says, please don't put anybody's names there, just do a medical power of attorney. So just do a medical power of attorney, but don't add anybody's names there, because if it's conflicting with your medical power of attorney, then the healthcare providers are kind of at a quandary on what to do. So it's best just to do a medical power of attorney without adding anybody's names there. And then this form just needs 2 witnesses to observe your signature. It does not even have a place for a notary. And it asks, once again, witness 1, not be of blood or marriage, not going to gain anything from your estate, and not in direct care of you at the time that this form is signed. That is your living will or directive to physicians. And then the last form that I want to discuss is called this out of hospital do not resuscitate order for adults. This is the only form that does need a physician's signature in order to be complete. So if you did your directives with an attorney and you think that you told them that you did not want to be resuscitated, the attorneys 99.9% did not do this form because it requires a physician's signature to be complete. So if this is a desire that you do not want to be resuscitated, please make sure that your out of hospital DNR is filled out properly so that your wishes can be honored. This is called an out of hospital DNR because once you are admitted into the hospital, they always ask what resuscitation status you would like, as well as those different interventions that somebody was asking me about earlier. So at the hospital, you do have more control over sort of a drop-down menu of things that you may or may not want. Out in the community, it is 4 interventions that are covered in this DNR. That's the chest compressions, rescue breathing, shocking with a defibrillator, or pacing with that defibrillator out in the community. This protects EMS and first responders from doing those interventions, but it does allow for comfort interventions. It does not mean that we're not going to treat a person with any love or care or interventions, but we're going to focus on things that can make them comfortable, like medications to help ease their breathing, or pain medications, some oxygen applied, helping them sit up, or addressing any immediate needs to help them feel more comfortable. Once it is completed, it's important that you keep a copy with you. They do ask if you make photocopies of it to copy the backside, which are just instructions. We have worked with EMS teams and firefighters that say they will honor a front side, but they do prefer the backside to be added. So if you are trying to do things appropriately, please photocopy the backside. Give copies to your healthcare providers. You can also go to the Texas Department of Health website and purchase a medical medallion or bracelet indicating that you have a completed form, and that protects you from having CPR out in the community. So it is a very specific medallion or bracelet that needs to be purchased through one of those websites off of the Texas Department of Health website. Don't just go to Amazon and purchase a DNR bracelet. That does not protect a person out in the community with those DNR bracelets off of Amazon. I know this form is very teeny. It is very complicated to fill out. Everybody, so the person would need to sign it or their representative in the presence of 2 witnesses or a notary, and then a doctor also has to sign it. The biggest caveat is down at the bottom. Everybody who signed the top portion of this form has to sign this teeny bottom portion in order for it to be complete and effective. A lot of times, even the physician will miss the bottom signature spot. So if you do not want to be resuscitated or your loved one does not, you can reach out to myself or Beryl. We can kind of peek at the form and make sure that it's filled out properly, or ask your healthcare providers to help you with that. The last thing before we take some questions, we do have a printable organizing affairs PDF on our website. You can go to hospiceaustin.org. We'll also send that out in our zip file. Or if you ask for written materials, we'll actually send you the booklet. It is exactly what it says it's doing. It's organizing all your affairs in one place in case if we were to die suddenly or to pass away, our loved ones would have our bank accounts, our insurance information, anybody we should reach out to, maybe passwords to our Swiss bank account or our Bitcoin accounts that would just be gone without those important things. So this is something you want to protect and keep in a safe place. Your directives really don't have any sort of binding information on it that could be a security breach. So those directives you could lay out on your coffee table, but you would not want to leave this packet of information called organizing affairs out for anybody. There's a chance in that information to write a celebration of life or your funeral memorial arrangements. There's also a really interesting page called your ethical will, which is just kind of your priceless words about your legacy. What's important to you? What do you want those behind to know about you? That could be more priceless than anything monetary or anything that you could leave them in the material world. Also, when we go get our driver's license or an identification card renewed in the state of Texas, there is a place that you can indicate an emergency contact as well as a directive. Let's see, let me move this. Oh, I can't. Well, sorry. Oh, there we go. There is a place to indicate on your application who has your directives. So you can add a phone number or your physician's phone numbers there. But that way, in case if you're in an accident, they can, when they look at your driver's license or even your license plate, they would know immediately who to contact to reach out to say, hey, your loved one was in a car wreck. Please go to St. David's or Ascension Hospital. We're sending your loved one there. So once again, it can access more efficient and quicker care for accessing your loved ones. So that's important to know. Out in Georgetown area, when you do renew, people ask you for these emergency numbers, but I've found that like in the Travis County area, they don't let us know about this important emergency contact space. So just next steps, once again, to review things, go to those websites, learn how to start having this conversation with our family and friends, figure out who you would want to speak for yourself if you could not. Talk to them and ask them, would you be willing to be my medical power of attorney? Talk to them about what's important to you. What are your goals? What's important to you quality of life wise? Think about your current health and what issues may come up. talk to your medical professionals about some of those things so you can think about whether or not those are interventions you would or would not want to do. Print out your advanced directives and your organizing affairs booklets. Get those completed. Give them to all the people on them, your healthcare providers, at least your directives, sorry, not your organizing affairs booklet, but make sure that your family knows where those organizing affairs are being kept. And then, oops, that's pretty easy. So my contact information is in the chat box. I'm going to stop sharing the screen and we can go to questions and address anything that you guys, or if you even have just something to share, we would love to hear that.
At this point, I am not seeing any questions. There's so much great information, Ginny. Thank you. If you have any questions, everyone, here, I should probably put my video on. Go ahead and put them in the Q&A and I will read them as they come forward. And in the meantime, I will let everybody know, I'm stealing Bobby's job for a second, that your feedback is very important to us. It helps us to develop these programs, these webinars, these conferences when we get a little bit of information from you. So I've put a link to a form in the chat as well. It's a survey, and if you could complete that, click on the link, it'll take you to a simple form. That would be great. It would be so helpful if you would complete that for us.
That survey also has a couple questions that helps to show for our grant from St. David's Foundation that we are providing information out in the community and you know, supporting the mission for our grant. So once again, yeah, as well as for Bonnie's and the program, that really helps us answer some of those questions. The other thing I do want to mention too,
And we do have a couple questions, Ginny, as well.
On your medical power of attorney, whatever form has the closest date to the present date is the effective form. So one time I was at a hospital and I had a family bring 9 different MPOAs up. And so I don't know if every time they got in a fight or something, they just redid their medical power of attorney, but we had to figure out which one was the closest date to the present date. And so that's just good to know. Let's see.
So one person put in the chat, how about legal competence? How is that established as dementia progresses?
So that's determined by their healthcare provider. And when, you know, a medical power of attorney or a guardian or somebody else needs to take over making medical decisions for them. So that would be a letter or a statement from one of their healthcare providers.
Another question asked is, are electrical medical records or electronic medical records nationwide? Is there a way to get these documents that you highlighted in electronic medical records?
So, you know, hopefully, Rebecca, I mean, that's a wonderful thing. So, right, hopefully in the next decade, we'll see a platform like this. I know 3 years ago, we had a meeting. There was a company in California that was actually just starting with 2 cities to develop a platform that would house their legal documents. That does bring up a good point. There are apps on Apple and Android called My Advanced Directives that you can download and actually store all of these things as well as some of the medical information. Most of the time on your phone, it'll be stored. That app can be accessed on your locked screen even. So EMS and those people that may look on your phone for an emergency contact may be able to access some of that. You can scan your directives and email those to your loved ones. So that way, like for my mom, I scanned her medical power of attorney and I just put, mom's MPOA in my email. So if she's ever at the hospital, heaven forbid, 6 years from now, I can just look up MPOA, find that, and then email that to the healthcare team at the hospital to print out.
A couple more questions. When a person doesn't yet qualify for hospice but is struggling with advanced Alzheimer's, what should a caregiver do to advocate for that loved one?
Oh, yeah. There's so many wonderful resources for Alzheimer's dementia or even dementia. So I highly recommend at least perusing those websites. I know that there's some great resources with the UT Alzheimer's dementia group, as well as Alzheimer's Association. I'm sure that maybe, yeah, I know Shirley's nodding her head about some of that. They might know a little bit more. I know it's such a hard disease.
I'm putting the helpline for the Alzheimer's Association in the chat. It's a 24-hour, 7-day-a-week phone number that you can call. And then another question somebody asked, do you, Hospice Austin, and this Gift of Time, or the Gift Project, pardon me, the Gift Project, do you support only here in Austin or all of Texas, or where do you serve?
Oh, that's a great question. So Hospice Austin covers 5 counties. And so that's also the counties that we serve for the Gift Project. That's Travis, Williamson, Hayes, Caldwell, and Bastrop. But if anybody is out of those areas and has questions or concerns, feel free to reach out to me by email or call me. I'm glad to try to connect or figure out how we can connect you with some resources.
2 more questions, and then I will pass it off to Bobby. It's 1 more question, actually. Beryl's been putting some really great information in the chat about how to keep your documents, where to keep them, etc. Someone asked, should I, as the medical POA, ask if all the maintenance drugs my loved one is on are prolonging her suffering with advanced Alzheimer's?
Yeah, so once again, thinking about quality of life and would our loved one want to exist in that state? Everybody's answers are going to be different, right? And so, yeah, hopefully, the physicians and nurse practitioners that are working on your loved one can also help to figure those things out. And focusing, if your shift of care really starts to focus on comfort and not extending their life or disease process as they start to fade and not recognize what's going on in this world. I mean, I think that's a very appropriate thing to do. So yes, I think, asking their healthcare team, are these medications necessary? Are we at a point now where they might not need a cholesterol medication anymore? And we also may find it's called deprescribing, that sometimes our loved ones actually don't need all these medications that they've been on for like 20 or 30 years. And actually coming off of them, they start to kind of come out of this fog. And so people have a better quality of life and interaction with the world, sometimes as they start to deprescribe some of these medications.
Thank you. 1 last quick question as Bobby's unmuting. Is the difference between palliative care and hospice care, is the difference that people who have short-term, 6 months left to live, should opt for hospice?
Right. So the biggest thing, well, yes. So I think there are more services with hospice care. So if you do qualify, there are more services. But once again, even if you're within that 6-month range, right, that no one would be surprised if you die or pass in that period of time. If somebody is continuing on more aggressive treatment measures or interventions, then it might not be time for hospice, and maybe palliative might be a more appropriate options. So it really depends on the goals and what type of interventions that person still wants to continue seeking. I think I saw somebody asking if, and Beryl answered about leaving copies in your glove box. I think that's a great place. You know, having an envelope available, having that folded up in your purse might be a place. And then Beryl, yeah, put taking photos of them and keeping them in a folder on your phone is a great place.
And I'd like to say something, I just wanted to say a personal, very big thank you to Ginny. The moment I reached out to her to do this presentation, she said, yes, ma'am, I'll be there. And so again, thank you, Ginny, very, very much. And Beryl, it was very nice to meet you as well. Thank you both for being here today.
Well, thank you so much for having us and asking us to join. I mean, this is priceless information for everybody. It's truly a passion of ours. And once again, please feel free to reach out to me if you guys have any other questions or concerns. I'm glad to be of assistance if I can. My cell number and email is up at the top of the webinar chat. And I know Bonnie can also reach out to me if anybody needs anything.
All right, well,
Bobby?
thank you. Yeah, thank you. I just want to thank Emily Rollins again of Town Square for sponsoring today's session. And Ginny, thank you, and Beryl for all of your presentation today. It was very, very informative, and I'm sure we all got a lot out of it, because I know I certainly did. And lastly, I'd like to thank my colleague and partner on this session, Shirley Trapani from Area Agency on Aging. And most of all, I want to thank everyone who joined us today for our first of 4 Striking a Balance Caregiver virtual sessions. And just a little reminder that there's still time to register for Saturday's conference. It'll be a good time to meet resource providers in person for that one-on-one opportunity, as well as meet other caregivers and enjoy a nice lunch together, and also learn more about becoming a resilient caregiver. And it's also free. So we'll be back tomorrow and Wednesday and Thursday at 1 o'clock. So if you'd like to join us again, just use the same Zoom link to log in for the other sessions. We look forward to seeing you.
And I'd have one more thing. I'd like to thank the
Yeah.
ASL interpreters for being online today. It was very helpful to have
Indeed.
them available. Thank you both.
Yep. All right, I think this concludes today's session. Thank you, everybody.
Thank you.